Why do you feel dizzy when eating less to lose weight? Dizziness when cutting calories can stem from low blood glucose, dehydration, electrolyte imbalances, or postural drops in blood pressure, and understanding what's behind it can help you manage it safely and know when to get checked out. Is it normal to feel dizzy on a calorie deficit? Actually, yes, it's more common than you might think. Let's break down what's going on. When you reduce your food intake, your glycogen stores, the stored form of glucose your body uses for energy, start to deplete. As they break down, they release water and electrolytes like sodium and potassium. That shift can leave you feeling lightheaded, tired, and a bit off. It's worth knowing that the dizziness most people experience when dieting is lightheadedness, a feeling of faintness or unsteadiness. That's different from vertigo, which is a spinning sensation and is less typical with dieting. Vertigo may need a separate assessment, so mention it to your GP if that's what you're experiencing. Dehydration and electrolyte loss are actually among the most common reasons people feel dizzy when dieting, more so than true clinical low blood sugar, which is a separate medical condition. There's also something called postural hypotension. That's when your blood pressure drops temporarily as you stand up and your body doesn't compensate quickly enough. You might notice it as a sudden head rush when you get up from the sofa or out of bed. Now, if you're taking any medicines, particularly blood pressure medications, diuretics, SGLT2 inhibitors, insulin, or sulfonylureas, it's really important to know that these can make dizziness worse when you significantly reduce your calorie or carbohydrate intake. Please speak to your GP or pharmacist before making significant dietary changes if you're on any of these. It's also worth knowing that persistent dizziness can sometimes point to an underlying condition. Iron deficiency anemia, low vitamin B12 or folate, and thyroid dysfunction can all cause lightheadedness and fatigue. If your dizziness doesn't improve or feels more significant than just the odd head rush, it's worth getting some blood tests done. So what can help? A few practical things to discuss with your healthcare professional. First, the pace of your calorie reduction matters. NICE guidance recommends aiming for a deficit of around 600 kilocalories per day as a safe target. Very low-calorie diets, those below 800 kilocalories per day, should only be followed under direct medical supervision. Second, eating regularly and including complex carbohydrates, things like oats, whole grain bread, and brown rice, can help keep your blood glucose more stable throughout the day. Third, stay hydrated. Aim for around 6 to 8 glasses of fluid daily and include foods naturally rich in electrolytes. Bananas, spinach, and potatoes are good examples. And if you do feel dizzy when standing up, try rising slowly from seated or lying positions. It sounds simple, but it genuinely helps. Now, most dizziness during dieting is manageable, but some symptoms need urgent attention. If dizziness is accompanied by facial drooping, weakness in an arm, difficulty speaking, a sudden severe headache, or loss of consciousness, call 999 immediately. These can be signs of something serious that has nothing to do with your diet. For anything less urgent but still concerning, dizziness that's persistent, getting worse, or affecting your daily life, contact your GP or call NHS 111. To recap, dizziness on a calorie deficit is usually linked to dehydration, electrolyte loss, low blood glucose from skipped meals, or a temporary drop in blood pressure when standing. Certain medicines can make it worse, so always check with your GP or pharmacist before making big dietary changes. And if dizziness is persistent or comes with other symptoms, get it properly investigated. As always, nothing in this video replaces personalised medical advice. Your GP or pharmacist is the right person to guide you based on your individual health and any medicines you're taking. If you found this helpful, give it a like and subscribe to the Bolt Pharmacy channel for more straightforward health information. Drop any questions or topic suggestions in the comments below. We'd love to hear from you.